Reporter Ben Felder with our content partner, The Frontier, published a fascinating behind-the-scenes article this week on how the Stitt administration dealt with the initial surge of the pandemic last March. He joins us now to share what he learned. Ben, how did you gather your material and how much of it was there?
Yeah, well, back in March when the pandemic was starting to spread, I think a lot of Americans pivoted their business to virtual video calls, mainly Zoom. And it dawned on us that the same was true for the governor, that he was holding a lot of his meetings over Zoom. So more than 30 hours worth of video call audio was returned to us through our open records request. And then we also requested any emails from senior staff that dealt with the coronavirus topic, and that produced more than 7,000 emails.
So who did he rely on for advice? Was it a large group of people? Was it a small inner circle?
When he was talking with doctors and healthcare professionals, that's where some of the, I'd say, confusion came on his part of not quite understanding sometimes what his executive orders meant for the health communities.
There was one executive order on elective surgery that caused some confusion. Tell us about that.
After he issued that order, he was told on one call by doctors that they had patients who needed surgery to treat cancers, tumors, heart blockages that were having to delay those procedures because of his order. And the governor admitted that he did not believe those kind of surgeries would be covered by his order. He really saw them as, quote, cosmetic surgeries that he was trying to ban. But then in a later call, he was talking with evangelical pastors, another group that he's familiar with. He is a Christian himself and is very familiar with this pastor group. He told them quite clearly that his ban on elective procedures included abortions, which I thought was an interesting takeaway, because no matter what your stance is on abortions, I don't think many of us would refer to them as cosmetic procedures.
How closely did he follow the guidance that was coming from the Trump administration?
There were often times when the president would contradict his own coronavirus task force's information or suggestions and recommendations coming from the CDC. So following the White House was, on one hand, maybe a difficult thing to do. But on the other hand, the governor regularly said that he was following CDC guidance, that he was following the president. He kind of famously tweeted a photo of himself with his children inside a Oklahoma City food hall, tweeted that it's packed, trying to encourage Oklahomans to continue to participate in the economy. A couple days later, the president was asked what he thought about the governor's actions. President Trump said that, his advice would be to probably not go to crowded restaurants.
Behind the scenes, how much was the governor grappling with public safety versus saving the Oklahoma economy?
Protecting Oklahomans' health was the top priority for him. And I don't think that the governor ever minimized the severity of the pandemic. But a close second, or a 1B, if you will, was protecting the economy. And that was something that the governor, from day one, was really focused on doing.
Ben Felder, it's an excellent article. Thank you very much for your time today.
Yeah, you bet. Thank you.